And I'd like to now invite for our last presentation this afternoon in the innovation space, Jacqui, Nolan and Jodie Robinson from Ballarat Health Services. This is the part, yes, thank you. Jacqui is the manager of Ballarat Health Services Dental and is trained as a dental assistant in private practice in Ballarat. She then joined Ballarat Health, moving into the manager position in 2013, and has since been part of opening up a new state-of-the-art 20-chair clinic and dental school in Ballarat. Jodie is the clinical coordinator at Ballarat Health Services and is a trained dental assistant in both private and public sector throughout her career, taking on the role of clinical coordinator in 2013. Both of our presenters have spent a lot of their career working towards better outcomes in oral health, and today they're going to talk to us about what they've done and what's occurring in the outreach program space. Thank you.
Thanks for inviting us to talk today. We're just going to do a very quick snapshot about our outreach services. We're here to our outreach services that Ballarat Health Services delivers on an ongoing basis. Sorry, you're a bit ahead of me, Joe. Okay. Deb said this morning that 75% of our population is eligible, that 75% of our eligible population are still not seeking help from us. And we know that healthcare is a fundamental right, and we wanted to reduce the barriers in accessing dental health care. These programs that we implement, that we've started implementing, are a part of reaching and promoting public oral health and trying to build dentistry, trying to bring dentistry to the people of Ballarat. We've changed our thinking and we want to be more present in our community. I should have worn my glasses. Sorry, this is really dark, this writing. Okay. So what we did was we identified the vulnerable groups within our Ballarat community, and we researched the statistics on who was coming from those vulnerable groups, and we communicated with the stakeholders to build some relationships. We looked at the reasons why people weren't coming. The affordability was one of the reasons, barriers for transport, co-payments and oral health care products. Availability, so with us going out, what our staff requirements would be and the technology we'd need to take with us. The accessibility, how easily can the patient access the care? And the relationship building, so education barriers, language barriers and past experiences. So we're just going to talk very quickly on all of the projects that we're doing at the moment. So one of them is our, it's written on here. Okay. One of them is our Aboriginal Men's Only Health Nights. This is a relationship that we've made with the elder men at the Badak, Ballarat Indigenous community, where our dentist goes and he shares dental information. And he encourages the men to trust us, and with them trusting us, then they will then share that news through the rest of the Indigenous community. So that's one of the projects that we're doing. Joe?
Some of you will already be familiar with our aged care our aged care facilities that we attend already. We've been running this program for a couple of years now, and we were actually part of the pilot that Jenny was talking about earlier. This has been a really valuable outreach service for us. What we've actually found with it is with the 10 different Ballarat Health Services aged care facilities that we're attending at the moment, that these residents wouldn't be getting oral health accessibility at all. Very few of them actually come into our clinic. So what we've been able to do is take that service to them. So we're taking our portable equipment, we take our compressor, like other people have been talking about before, and we perform their dentistry needs at the point of care. So whether that's actually in their room because they're bedridden, or whether that's in one of their tub chairs, or whether that's in our portable dental chair. So it's actually been fantastic. What we also offer with this outreach program is education for staff. So something that Jenny was talking about earlier is that a lot of the residential aged care staff think that they're doing a wonderful job, but the results actually show us differently when we evaluate it. And the information, I actually run those information centre sessions as a Cert 4 oral health promotion nurse, is that the evaluation afterwards is that the staff are really grateful that we're sharing product knowledge with them, that we're sharing what we've actually found in those procedures. So it's been really valuable.
One of the good things that we're just implementing with aged care at the moment is we're trying to make it easier for the staff. So we would say to them in an oral health care plan, this is what an aged person needs, to have their denture taken out at night, or they need to brush in the morning, or in the evening. But a bit like you're saying, the staff come on and they change. So we're making up laminated quick check signs that we put in the aged care person's bathroom, and it'll have this person wears a denture, needs to come out at night, needs to dry. You know, it'll be a check system, so it's just quick for each staff member to do that for them.
And whether they need assistance or whether they can actually do it on their own, depending on the level of care that they have.
It'll say whether they need care from the person helping them.
One of the other things that we're doing is a school engagement program. So we head out to primary schools and secondary schools, and we actually conduct examinations at that time. So we take our portable equipment out with us. We do a full examination, a report back to the parents that goes home with the child, and it tells them whether we've found any decay, whether we've had to apply fluoride. Obviously, before any of these programs run, we send out all of the consent forms depending on what program we're running. We've actually been able to see 253 primary school aged children, probably in about the last 18 months. We haven't been running this program very long, which is a huge number that is then fed either on a recall basis, dependent on their needs, back through our clinic, or we've actually been able to get those children into the clinic for ongoing care. We don't do treatment at primary schools or secondary schools at this stage. And we've actually seen 49 secondary school aged children. We find that our compliance rate isn't so great with secondary school, but it's a great message at the moment that if we can get to children at primary school, then they're more likely to continue that care after the event. We also offer oral health care promotion when we go to these schools, and we do that on a class-to-class basis rather than in big groups. We find that works better for us. We get the children engaged in the conversation, and that's relevant to the age of them. So depending on whether I'm talking to preppies or whether I'm talking to 15-year-olds, depends on whether I'm telling them how to brush or I'm talking about the science behind dentistry and how to get them engaged in that way.
Our next program, you may have seen this, it was on the project on Channel 10, and it was on a couple of years ago, and it's actually about to be on Channel 10 again on the project to see how far we've come. It's our Young Mums program. I used to call it the Peter Innes program. He's basically the guy that started it. He was a teacher in education. He's actually a counsellor in Ballarat now. He started a school for girls that get pregnant while at school, and these are girls that are actually got no support at all. So mum and dad have got angry, or they didn't have mum and dad in the first place, or they've been kicked out. Some of them have lived in cars and all different things. The project basically was started when Peter just kept ringing me going, I've got a girl with a toothache, would you be able to help me out? And I said, of course. And in the end, I said to him, look, how many girls do you have? And at that stage, when the project first started, there was only 29 girls. And I said, look, let's just do them all. So it wasn't going to be as easy as that. They didn't trust anybody. They didn't trust hardly any adults at all. And basically the whole program is that it's a house, and they have to stay, to be eligible, they have to stay in education, and that's what Peter provides while they're having their pregnancies. They have a bub, they often get pregnant again, and they're staying in that education system. So we go there, we offer them life skills as well. At the stage when we first started, we didn't have much funding, and they would come in for once a week, and that would be the only meal some of these girls would actually get, would be once a week. So we'd show them how to cook a healthy meal, and they'd all have that meal. But now we're offering the service, it's 4 times a week that they can get a hot meal. The girls are really, there's a lot of domestic violence with boyfriends. We've had situations where I've turned up and dad's taken the baby and mum's crying, and everything. It's really, really awful. We've lost one girl to prostitution and 2 to drugs, but we've got more than 29 girls now. What my part of dental is that we go there and we build relationships with them. So we go there, we build a relationship, they get to know me and whoever else I've taken from dental, and when they come in to see us, they want us to be there to hold their hand, they want us to be there to look after their baby, they want us to help them get to have that support. It's been a really great project because my staff have got on board and they've donated clothing and prams and all different things, so it's been a really wonderful project, and you'll probably see it on the project on Channel 10 coming up again soon, so that's something we just absolutely love doing. We also used to take platters of food and so cheese and biscuits and fruit, and the girls couldn't believe their little kids, because we've been going for a little while now, they've got little kids, eating this stuff. They go, oh, I just wouldn't believe they'd eat that. So we're trying to change perceptions on, sometimes fruit's a bit cheaper than the stuff you're providing. So we've treated all of them, they've all been treated, and all of their children as well. And each time we get new ones, it's most of them. So the age range is about 14. We've had a few at 14 pregnant, up to about 17. So now that we've been going a few years, some of the girls that have been really, really great girls have stayed on to about 21 years of age, so we've still got them. So,
just in regards to that too, Jacqui, just on a side step to it, we're actually hiring at the moment. We're looking for trainee dental assistants, and some of the girls that are part of this program have actually applied for the position. So it's been a really positive, partnership out in the community. Most of you will be familiar with the SRS services that a lot of us actually offer. One of the things that we're doing at the moment in regards to this is because we have so many outreach programs, and these run on a week-to-week basis, and we're using our portable dental equipment nearly daily at the moment. We have somebody off
sometimes
site.
2 chairs.
and we're getting to the stage now where we actually need 2 chairs. So we're looking at, because our SRS program is expanding, we're actually looking at purchasing more equipment so that these outreach programs are a part of our daily running of our clinics. So going from 22 chairs to however many outreach chairs we can get at the same time. The SRS program runs simultaneously with the dental clinic. We do the same sorts of things. We offer oral health information sessions. We provide oral health kits to the SRS residents. They also include the tick sheets that we send to aged care, so whether they've cleaned their teeth in the morning, whether they need to take dentures out, those sorts of things as well. And it's about creating that network through the SRS community and expanding that service. These are people that will not come and see us for a number of different reasons, and it's not necessarily just because they can't get there. So with us turning up at their homes, we have a very captive audience. Everybody loves it when we turn up. We do take out morning tea with us, the same sorts of things, great choices.
They love to share food.
They love to share food, they love to share stories, and it's a really great day when we go out.
Yeah.
So.
Just letting you know also, part of our SRS project, we decided that we would make sure that all treatment was done, and all treatment was done on every client.
The homeless youth program is actually something that I'm extremely passionate about. Jacqui came to me and talked to me about it.
It's a new project.
Probably about 12 months ago, and it's been something that we've been formulating. We've actually run this program twice now. It's in conjunction with Ballarat Community Health Centre. I've been present for both of those visits now, and I've actually come away in tears the first time. It's amazing to find out in the Ballarat community, and we're a reasonably small community of about 110,000 people, that there are so many children living on the street or couch surfing, and the state of their oral health because of drugs, alcohol, and the position that they're in. And the fact that they know our service is available to them because they've heard the messages through primary schools and that sort of thing, but they've lost their way, is incredibly disheartening. So what we do is, Ballarat Community Health Centre is a new facility in Ballarat. These children are familiar with this centre because they go for a number of reasons. We take our equipment to them. We have performed treatment there, and the treatment that we can't do there because of the complexity of the treatment that they need. We are actually organising transport for them to get into our clinic. I turn up at those appointments so that they see that friendly face. We had one child who was 17 and unfortunately his life was very out of control. Prior to Christmas, I managed to talk him into coming into the clinic. He was in a world of pain, but he couldn't have cared less. He came in, he saw one of our dentists and he basically walked out, not because of our dentist, but because he wasn't familiar with the situation. I managed to get him on the phone after ringing him a number of times and him screening my call, and explained to him who I was, because I wasn't there the first time he turned up, convinced him to come back in. I managed to get him to see the dentist that was with me with his first visit, and we did manage to get 2 teeth out for him prior to Christmas so that he wouldn't be in any more pain. Unfortunately, after I've called him a number of times, he hasn't come back in to see us, and my understanding is, talking to the community health centre, that he they've lost him as well. But what has been happening is that these children are coming in to see us and we are making a difference for them. So I'm really proud of this one.
Oh, sorry, I was thinking something about that, but I forgot.
Sorry.
That's okay. Just with the homeless youth, the difficulties that we were hearing, I mean, these are stories where we're really talking about kids. We're not just talking about kids that are just homeless and somewhere there. They really are nowhere. And what they're saying to us is, well, that's okay, but I actually don't even have a sink, let alone a toothbrush.
Or that they move from couch to couch.
So I like the idea
quickly.
of spitting into a paper, whoever brought that up before. We could teach them that. So that's a really good idea.
Smiles for Miles, just very quickly, which most of us are actually running. We've actually extended this program to, instead of just oral health promotion and going into kindergartens, we actually take our portable equipment into kindergartens and we do examinations on the spot. So we go in, we do a full examination, we report that off to the parents, and we've actually gotten some really great feedback with children coming back into the clinic, plus they're going on recall, and we're using that CBDS money.
So our time's currently up, so we'll just go very quickly to the next slide. This is pretty much the last thing. This is our Expectant Mums program. One of the things is we found out is pregnant women are just not coming to us. They absolutely are not. So we've decided, we got a little bit of funding through the Wrigley's Foundation, through the ADA, so we actually decided to hit them. This is a new project that we have. We saw 78, we decided not to discriminate whether you had a card or not. We saw 78 women in our first few days, and 42 of them were eligible and 41 needed care. 4 of them were in absolute agony who needed urgent care and full clearances. So we are not seeing these women. The obstetricians are like just saying, we absolutely love this program, please be here every single day. Ballarat Health Services told us that that week they had 157 new mums registered. Now they're not coming into us. So I could say a lot more about it, but I know our time's up. I just have to say that we've offered all of our programs. We've got thousands more things that we do, but we've offered all of our programs to our students from La Trobe. We have a list up of all the stuff that we do in our calendar year. They all put their names on everything, so we then had to say, okay, we'll have to divide that up a bit because they all wanted to go. But yeah, we're just doing lots more things. So thanks.